NCID is the national centre where we receive most of the COVID cases. For the adult COVID-19 cases, majority of them are taken care of at the National Centre for Infectious Diseases, NCID. Now for children less than 16 years old, they are taken care of at the KK Women and Children Hospitals, as well as the National University Hospitals. When a person is in isolation, there is a certain degree of fear, anxiety. So we do have a group of medical social workers to provide them with emotional support. We also provide supportive management, particularly taking care of their mental states, make sure that while during isolations they can maintain a good physical as well as mental health. In intensive care, we have teams of healthcare workers to take care of our very seriously ill patients 24/7 round the clock clinical care. From the frontline perspective, I would say that we are definitely much more prepared compared to the previous SARS outbreak. So first of all, we have good infrastructure. We now have the National Centre for Infectious Diseases with good isolation facilities. Two is that we are more prepared in our diagnostic capability that allow us to be able to diagnose the case. Fear is a common reaction. For frontline healthcare workers, we not only take care of our own personal protections, we also want to protect the entire community. So first of all, before we enter into the patient care area, we will change into the ward attire. And we will use the personal protective equipment to protect ourselves during the course of work. And it's also important for all of us to monitor our own health, including checking our temperature, checking to see whether or not we develop any symptoms, and know what to do if that should happen. At the end of our duty, we will shower and we change to our home clothes before we enter into the community. Vaccines will be a very important piece of research, and we need to develop good vaccines that we can use to prevent disease transmissions. However, to be commercially available, it will take a long while to come. Meanwhile, it will be important for all of us to take care of our own health, protect ourselves through good personal hygiene, and if you develop any symptoms, it will be good to seek early treatment and isolate yourself from the rest during the symptomatic period. And together, Singapore will be able to make it through this unprecedented challenge.